So today I'm working with Mr. Kelly. He's a 48-year-old male who came into the hospital because he was in a motor vehicle accident. He went into surgery and had an abdominal surgery, as well as his left leg was amputated. I was told by the doctor today that we're going to be inserting an NG tube. It's currently post-op day 2 and he has a paralytic ileus, which means his intestine is paralyzed and isn't working properly. So we're going to use an NG tube for decompression. I've already checked the orders. For an NG tube for decompression, you use a 14 to 16 French tube. So I have that with me. I have all of my other equipment as well. I've already spoken to Mr. Boyd today. He's doing well. We've done vital signs, ABCs, a head-to-toe assessment focusing on his abdomen as well as on his leg and other wounds. We've done a pain assessment. He's currently on morphine and that is controlling his pain well. So we don't have to worry too much about that. I've washed my hands, gathered my equipment, and I'm going to go speak to the patient. So, hello, Mr. Boyd. I'm Paisley. I'm a third-year nursing student in Vancouver Island University. We've met before. How are you doing?
Good.
Good. So the doctor ordered an NG tube to be placed for decompression of your stomach. Have you had an NG tube before?
No.
So essentially what's happening is your intestine is paralyzed in a way. After surgeries, well, during a surgery, we slow down all of your intestines pretty much to a stop, and then it takes a little while for them to start running again. So until it starts running again, we're going to take all the stuff that's coming through your stomach so that it's not building up. Is that okay with you?
Sure.
Perfect. So do you have any questions for me about it?
Nope.
We'll go a little further into it in a minute. Have you ever had any sort of surgery on your face or broken your nose or anything?
No.
No? Okay. So I'll explain to you how this works. This tube will be inserted into your nose and then down your throat into your stomach. That way we can suck out any gastric content that is in your stomach. I'll get you to tilt your head back. We'll put it in your nostril. We'll feed it through. And then at a certain point when it gets to your nasopharynx, which is back here, I'll get you to tilt your head forward like this. You're going to take your glass of water and you're going to take sips of your water. As you swallow, I'll continue to feed the tube in until it's in your stomach. So it's a bit uncomfortable. If you find that it's too much, you won't be able to really say anything, but just put up your hand like this and I'll stop, okay?
Okay.
Okay. So before we begin, can I just get you to spell your first and last name?
Kellybody.
And your date of birth?
May 16th, 1978.
1972.
2.
There you go. And then I see you have an allergy band, but it says that you don't have any allergies. Is that correct?
Correct.
Awesome. All right, so I'm going to wash up my hands, and then we're just going to do a couple of things. So the first thing is I'm going to measure to see how long we need the NG tube to be. Can you sit a little further forward and straight up for me? Thank you. So we're going to measure from the tip of your nose to your ear, and then from your ear down to your xiphoid process, which is about here. That's 17.5 inches. So then we're going to take the NG tube and measure out 17.5 inches, which is right here. I'm going to tape it so that I know where that is. All right, I'm going to make sure my hands are clean. I'm going to put on my gloves. For this procedure, you would attach an O2 monitor to the patient's finger so that I could see their blood levels. So this procedure is uncomfortable. There's often some burning involved. Again, what's the signal? Do you remember? Just the hand? Perfect. So we'll begin if you're ready. You ready?
Sure.
Okay, so according to the textbook, you can lubricate the NG tube in water. I assume you could also use other lubricants in the hospital setting, but the textbook does say water. Can I just get you to pull your chair a little closer to me so that you can be seen better in the video? Thank you. And now, to know which nostril we're going to be putting it in, I'm just going to get you to take your finger and cover your nostril and blow. And then cover the other side and blow. And then you tell me which side had better airflow come out.
This side.
That side had better airflow, so that side is more open and we'll be putting the tube in that side. Is that okay with you?
Yes.
Wonderful. So I'm just going to get you to tilt your head up. Here's your glass of water for when you're ready. The tube is lubricated. And I'm just going to begin feeding the tube in your nostril. And then now it's at your nasopharynx, so I'm going to get you to tilt your head down. Tilt your chin like this. There you go. And then start taking gulps of water. And for this video, I'm just going to tuck it behind you so I know, so it's not in the way. But we're going to be feeding it in as you swallow. You're doing well. And then once we get to the tape, we're going to stop. And again, I'm just going to tuck this into his sweater so it's out of the way. Wonderful. And then I'm going to take some skin prep. I'm going to rub it on the nose. Let that dry. And take my tape. Now in the hospital, they have special clips for the nose, but I only have tape, so just gonna put that there, and then you can tilt your head up. I'm gonna put 2 pieces of tape on just because the tape isn't the best, and we want to make sure that stays in your nose. How is that? Is that okay?
Sure.
Sure. And then we're gonna take a rubber band. And we're going to wrap this around the rubber band and pin it to the shirt just so it's not being tugged. Perfect. How's that feel? Okay?
Sure.
So currently it's just in a little loop here. If you're attaching it to suction, you could just pull this off and attach it to your suction here. But we're just going to leave it closed for now. And then the test to make sure it's in the right spot, the best test is to get a chest x-ray done. But if you can't get a chest x-ray done, you can use a little pen light. And I'm just going to get you to open your mouth, and I'm going to check the back of your throat to see if the coil has, if it's coiled up, sorry, at the back of your throat and isn't in your stomach. So tilt your head up a little more and stick your tongue out. I'm just going to push your tongue down and look to the back of your throat. And I can see that the tube goes down the throat. And then another test other than x-ray and checking the tube is you can pull up some gastric content and then look at the pH with one of these strips. A pH of 5.5 or lower indicates that it is in fact in the stomach. Anything higher indicates that it's in the small intestine. So that's all we have to do today, Mr. Boyd. Is there any questions you have?
Nope.
Wonderful.